Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. I just wanted to begin with a quick update with the prisons. Any feedback from them? We know a few prison officers and prisoners were previously infected.
I think you'll see the numbers coming down. Right now at Lusignan, we have about 7 or so persons, both prisoners and officers who have been positive, but they've been in isolation. We have some cases at Timeri and some at Mazaruni. The same thing, they have been in isolation for several days now, and in 10 days' time, we are going to be able to discharge them because, again, most of these cases have been mild or asymptomatic. And our protocol has been that after 10 days, if you don't get moderate or severe COVID, then we can discharge you within that 10 days period.
Okay, thank you, sir. The CDC in the U.S. has advised persons against traveling to Guyana, and they've placed the country on level 4 of their COVID scale. That is the highest level. We just wanted your thoughts on that.
Well, the CDC has a scale that they're using to classify countries. And if you go to the classification, you would see that most countries are actually on that highest level. The way that they classify people, you got a level 1, level 2, level 3, level 4. A level 1, you have to get less than 5 cases per 100,000. Level 2 is between 6 to, I think, 50 cases. Level 3 is between 50 to 100 cases, and level 4 more than 100 cases. The reason why we have been classified along with other countries, including Barbados and many other countries in the Caribbean, is because over the last 28 days, we would have seen more than 100 cases per 100,000 population. And if you are within those numbers, then you'll be classified as being in the highest tier. As I said, if you review the charts, most countries are in that category. And there are other countries, because of the circulating strains, that the U.S. have actually imposed severe travel restriction, meaning that people can't even come from those countries. We are not in that category.
Okay. All right. Thank you so much. In addition to the Safe Space Hotline launched last year, what other programs are being planned to provide for the support for persons who may be struggling with mental health? But before you answer that, I wanted to talk about the budget. $26 million has been set aside for the 18-bed mental health ward at GPHC. I know we have a psychiatric ward there, so I wanted some clarity whether this will be a brand new facility or an addition.
I think this might be expanding the existing facility so that we can accommodate more patients at the Georgetown Public Hospital. In addition to that, you would know that we have psychiatric beds, say in New Amsterdam. So one of the things is that when patients get acutely ill, they need somewhere where they can come in, be hospitalized, stabilize, and then we're able to send them home again. So that's the reason why we need some additional beds. And we're hoping that we would be able to implement that over the next couple of months.
All right. And I know that the ministry has been focusing a lot on mental health issues across the board, especially in light of COVID-19. So we wanted to know what else the ministry is working on currently or will begin working.
Well, there are a couple of things. The first one, really, and these you'll see us pay more attention to it after the budget. One, we have to develop a legislative framework under which the mental health would operate. And we are in the process of drafting a new mental health act or a bill, which would be going to Parliament. There was one that was drafted in 2010, so we are currently consulting on that, and we are going to revise that based on stakeholder feedback and so forth, and hopefully we can get this bill to Parliament as soon as possible. That then sets up the overall legal regulatory framework in which we'll operate. Secondly, we have two plans, strategic plans for mental health that we are working on. These plans, as you know, the ministry normally do like 5-year plans. So the one dealing with mental health came to an end in 2020, and we are in the process of doing the review and evaluation of the last plan, and then seeing what it is that we'll have to put in the next 5 years in terms of mental health. What are those plans? What are the areas we need to expand and so forth? And a subcomponent of all of that would be the suicide prevention. So generally we normally do a separate document for that, but it falls within the realm of mental health. And therefore, when we do the mental health plan for the next 5 years, we'll also complete the suicide prevention plan. In the mental health plan, apart from getting our primary health care physicians and nurses to better recognize and to be able to detect mental health issues, we also want to incorporate a component of our mental health program to deal with substance abuse, because this is an area that we feel we are seeing a lot more cases, and therefore we have to address it. A lot of assistance is currently being given by non-governmental organizations, but we think it's important that we are able to detect the challenges with substance abuse and to devise programs on how we can assist people with these challenges. So that would be one of the components of the new program going forward. So we want to do it in a very systematic way, and following the plan, you would see us rolling out different programs depending on the feedback that we'll get from the stakeholders.
All right. I wanted to touch on another subject with regards to the budget. The $70 million that was allocated for the shortage of medications for psychiatric patients. I just wanted you to speak to us on the situation when you came into where it is right now.
Well, again, overall, we've had challenges with shortages of drugs and reagents generally. And that has been a big problem because reviewing the ministry's purchasing of these things, we have seen that many of the types of medications that were required were not purchased in a long time. And so there were gaps, there were shortages that were there. And when people come to our health facilities or hospitals and so forth, they were not able to access these medications. We have bought some emergency supplies, and it takes a little while for the suppliers to make sure that all of these things are in place. And so we still have some shortages. So we have not been out of, we have not been out of the woods, so to speak. We still have shortages of some medication, but we are working to correct it because we recognize the importance of it. Psychiatric drugs are one of those specialized drugs that are really needed in the system. And in this budget, that allocation is there, recognizing the importance of having these medication for these patients and having it in a timely manner. So again, once budget is passed, we'll make sure that we are able to have all the medications in adequate amounts so that we can deal with the patients who would need them.
All right, back to COVID-19. Starbrook News is asking if you can, they said yesterday when we spoke, you talk about the current, the drugs from Barbados being exhausted or nearing that. So they wanted, just for clarity, whether the second dose, whether, let me just get that clearly. They'd like to know if you'll be keeping some of the same vaccines for the second dose, or it's going to be coming from another batch. We did address this before, but just for them, could you?
So we have received 3,000 doses from Barbados, and we have two options available to us in terms of administering those doses. One, we can administer 1,500 doses as the first dose, and then keep back another 1,500 as the booster dose. And that, we'll have to administer that 3 months from now. So we will make that decision as to whether we will keep those 1,500 doses. My sense is that because of the arrangements that we have in place, we will be getting many more doses of AstraZeneca vaccines that would be start coming in by the end of the month, and therefore we would have enough supplies to last when persons need their booster dose. So my sense is that we can do the 3,000 dose now, and then when persons need their booster, we'll have vaccines, the AstraZeneca vaccine available to be able to give that booster dose. But I would have to talk to the technical people to get a clear sense of what their decisions are.
All right, just a follow-up to that one. The current batch that we have, and we discussed the batches and the difference and so on. So nothing is wrong with using from this batch and then the follow-up being from another batch once it's the same.
No, there's nothing wrong with that. Generally, when we give vaccines, it's the same vaccine. So in this case, we're using AstraZeneca vaccines that has been manufactured by the Serum Institute of India. So there's a standard way that these vaccines are put together and so forth. So if you use from batch 1, then you don't have to keep the second dose from batch 1 to administer 3 months after. You can use the doses from batch 1, and then later on, 3 months after, you can then give from another batch. That's quite fine. What is not permitted so far is that you can use first dose, say AstraZeneca, and then go and use second dose from another type of vaccine, right? So that one, so far, that has not been permitted. But they're running clinical trials to determine whether you can do first dose of one vaccine and a second dose of another, and to determine what might be the implications of such interchanging the vaccines. They don't know what might be the changes, and that's why they're doing these clinical trials.
They're asking if just a review or an update rather on the cold chain storage facilities.
So we are, as I had said to you before, we're expanding our cold chain facilities. We're doing physical work on 14 sites, and some of them have been completed. I think the one in Region 2 has been completed. They're now finishing off a paint job. They're painting it and so forth. So by the end of this week, we should be substantially completed with the 14 sites that we're working on. There are 1 and 2 that is lagging a little bit, and we'll have to pay some special attention to those. But these are going to be sites where we will be able to do regional storage of vaccines. And so apart from building out the physical space, we are also giving them refrigerators to be able to expand our capacity at these vaccination sites.
We wanted to ask you for an update on the filaria exercise that's going on right now. And just before you address that, we had a question from the Guyana Chronicle that would be a follow-up. So they're asking, has the ministry launched an investigation into the death of a police constable after he allegedly took two chickenpox vaccines and filaria pills? Can you say whether it's safe to take 2 doses of the chickenpox vaccine on the same day? So,
Well, we heard about this. I heard about this last night, and the ministry has launched an investigation into it because we have to ascertain the facts before we can make any pronouncement. We heard that 2 vaccines were given to this person, and at the same time, he also took the filaria tablets. I don't know at this point in time whether that is indeed so, but we will have to investigate it. As we speak, we have put together a team from the Ministry of Health and PAHO WHO to pull all the documents relating to this incident from the health center where he went and to launch that investigation. Generally, when we review the safety profile of, say, the filaria tablets, you're not supposed to have any adverse event like this, and therefore, in my view, it might be purely coincidental. But nevertheless, we have to allow this investigation to take its course and let the experts review it, and then we will be able to report on what their findings are. Because nowhere in the scientific literature have you seen anything like this. So hence my personal view is that it might be purely coincidental.
okay. And the MDA program, just an update on the filaria program.
Well, we have been rolling out the filaria program in both Region 4 and Region 3. And so far, the feedback has been good. People have been accepting their medication. And I'm very optimistic that once we continue this way, that we will be able to meet that level that we're looking at least 70-75% of the population.
Minister, I noticed that the European Medical Laboratories has come across some instances of persons are forging the COVID-19 test results in order to leave the country. Can you say if the ministry has received these reports and what systems are in place to hold these persons accountable?
Well, once we find those persons, they are going to be prosecuted by the police. And that's the very simple answer. We have had some reports, not so much of people going out, but we've had reports of people coming in where they were forging their PCR results, because remember, we require PCR to come into Guyana. And that we had reports that people were forging their PCR results to come to Guyana. And we have launched an investigation into that. We have alerted the airport authorities for those respective countries, telling them that this is something that we have heard of, and we would like them to be extra vigilant. We have alerted the airlines that are bringing in passengers from these destinations. So we have done some of that work to heighten the vigilance in terms of coming in. But here going out, I haven't had any specific cases, but what we have been able to do, because the U.S., let's say you're going to the U.S., it requires, you can do one of 2 types of tests. They're accepting a PCR test or an antigen test. And in our country, the only 2 labs that have been certified to do PCR would be the National Public Health Reference Lab and the Eureka Medical Laboratories. However, we have licensed several other labs to be able to do the antigen test, which is a simpler test to do. And I think currently we have about 7 such facilities. And these would have, once we license them and we are, certain, and we have tested them that they are able to perform the test, then we'll grant them this approval. Once an approval is granted for a particular lab, we also would then inform the airport authority so that when someone show up with the test result, that it can be validated by the airport authority and by the airlines. So we have to write to them to make sure that they understand that this is a genuine laboratory test. So we have been doing that, and as I said, I don't have any specific cases that people going out would be forging the results. But again, if we catch anybody, they will be prosecuted.
When you say prosecuted, is that equivalent to jail time, or is there something in the public health ordinance that outlines that?
In the public health ordinance, we can detain that person. They'll be taken to the police. They'll be interviewed by the police, and the police would make a determination on the relevant charges, and then they'll be brought to court.
Understood. How often would you recommend persons to get tested for COVID-19?
Only if you've been exposed, and if you've been exposed, it's advisable that you wait probably about 4 to 5 days before you do the test. But in the meantime, if you're certain that you've been exposed, it would be better that you quarantine yourself during that period, and then after the 4th or 5th day to be able to be tested. The simple reason for doing that is that the test would be more sensitive, because as you can imagine, if you're exposed, the virus gets into your body, it multiplies, and by the 4th to the 5th day, the viral load in your body would be high enough so that it's easily detectable by the PCR test. If you go too early, the chances are it can return a negative test, and therefore a couple days after the viral load goes up, but it was undetectable early on. So it's better to wait a couple days and then do it, and then you're certain that you're, whatever the results come up, you will be certain that this is what it is.
In reality, some persons do not know when they're exposed. So for those persons who might have some fear in them, I get tested today, my results came back negative. How soon again can I or should I get tested?
Well, we shouldn't be testing, like every other day going to get a test. That's going to be too much, So you would know, first of all, whether you're observing the protocols. So if you have been abiding by those protocols, keeping your distance, wearing your mask consistently, avoiding crowds and so forth, washing your hands and things like that, then you minimize that risk. And also, if you are in a low-risk environment, right? So you're not working in a hospital, you're in a low-risk environment, then the chances are far less than if you're in a high-risk environment. And therefore, persons need to be able to think about that. But unfortunately, with this disease, there are lots of people who might be asymptomatic. And if they're not abiding by the protocols, then they don't wear a mask, they can easily share their infection with you. So that's why we have to get people to understand the importance of abiding by these things. If everybody wear their mask, you minimize that chance of transmission, right? But what we don't want is we want people to be concerned and to be able to take genuine steps to determine whether they're positive or not, and take the steps thereafter. But we also don't want people to be, how to put it, like extremely, extremely concerned that it becomes, in a way, pathological, So every other day I have to go get a test because I'm afraid of COVID. That's not going to be the right way of approaching it, right?
All right, Minister. Vaccine storage. With the AstraZeneca vaccine, it requires some amount of cold storage. How is the ministry going to, especially when you're administering the vaccines to persons in the hinterland regions and so on, how are you going to ensure that these vaccines are stored at the level that they should be before being administered to these persons?
But that's why we're building out some of the facilities. In fact, right now, we have a number of regional storage sites for vaccines. right? But because we want to continue our current immunization programs for children and at the same time do the COVID-19 vaccines, we wanted to add some additional space. So that's why we are expanding a lot of these regional sites. So we have 14 sites that we are expanding right now. As I said before, most of them are almost complete. And then we are adding additional fridges and refrigerators to make sure that we have the 2 to 8 degrees Celsius storage. That would work for most of the vaccines like the AstraZeneca, the Sinopharm, or the Sputnik 5. We have also procured additional freezers that can store vaccines at -20. So those freezers can be used for the Moderna vaccine because that requires a temperature of -20. And we have also acquired freezers for -70. And that is really to cater for the Pfizer vaccines. The challenge with the Pfizer and Moderna vaccine, however, is that it is a lot more difficult to get because there's a current demand for it in the US and Canada and UK and the EU and so forth. And many of these countries had pre-ordered these vaccines, so the companies have a huge backlog to fulfill for these countries. And only after they would have completed those backlogs that they would be able to sell to other countries. So that has been the challenge. But when we were looking at accessing vaccines, we wanted to make sure that our system is capable of taking in any one of the vaccines that would become available to us. We know that through the COVAX, that they have very limited supplies of Pfizer vaccines that they can make available to the countries, and that's why we have also prepared our system to be able to accept such vaccines. Through the African Union CARICOM relationship as well, one of the vaccines that possibly we might be able to get through that mechanism might be the Pfizer and Moderna vaccines. And again, that's why we have made provision for it. So if we're able to access it through that mechanism, then we have the storage facility to be able to store them safely, and then we'll administer it to the population.
But for those persons who are administering the vaccines that are on the move, especially in the hinterland regions, what type of storage system is in place?
Oh, that's simple because what we do have, we have containers. And these containers, it's something that we've been using all the time, right? These containers, they have some packs that are inside, and the 4 corners. And you would put dry ice in it. So dry ice would maintain the temperature of the cooler for about 3 to 4 days. And so we can put X amount of vaccines in these coolers. We go out to a community. We can spend a day or two out there doing the vaccination. Then we come back, we refill, we do and we continue that. That is how we have been doing our traditional vaccination, because when we go out to all these remote communities, that's the way that we have been taking out vaccines. And we'll continue doing the same. We have actually acquired some more of these containers to expand the amount that we currently have. And you would recall a couple weeks ago, UNICEF has donated about 30 more containers to us. So yeah, that's how we'll take it out.
Final question, Minister. The field hospital, can you say if it's operable?
No, not yet. But we're right now working on siting it, and we'll put it up shortly.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and our social media platforms.